So once again, good morning, good late morning, everybody. Welcome to the session on the future of research in dementia, future researchers in dementia. And it is my honor to welcome you all. So once more, welcome everybody. Our pleasure that the room is so full and that you are so interested in the future of research and in the future researchers. Warm welcome. We will not talk much in the beginning, just to introduce ourselves. I am Ieva Holmerová, past chair of Alzheimer Europe from the Czech Republic. My pleasure to be here again with you and...
Thanks, everyone. My name is Fania, Dassen, and I'm the coordinator of Integrative Academy, the training network for early career psychosocial researchers in dementia research.
And immediately I would like to welcome and introduce our first speaker, Thanos Chatzikostopoulos, not easy task for the beginning, from Greece, who will speak about the effects of pomegranate seed oil on mild cognitive impairment. You have 5 minutes to begin and to finish. Thank you.
This is more difficult task from my name. So I will present the topic about the effects of pomegranate seed oil on mild cognitive impairment. The pomegranate seed oil is produced by the seeds of the fruit pomegranate with the method of cold pressing. The benefits are that it has antioxidant effects, anti-inflammatory effects, anti-diabetic effects, and reduces the hepatic enzymes. In the present study, the participants took 5 drops of every day, and the primary objective was to measure the effects of pomegranate seed oil on cognition of people with mild cognitive impairment after 1 year of treatment. It was a randomized clinical trial with 80 participants. 40 of them follow Mediterranean diet, and 40 of them followed Mediterranean diet and took pomegranate seed oil. In the procedure, we evaluated the blood biomarkers. There was a follow-up after 1 year of treatment and a neuropsychological assessment with all these neuropsychological tools. In the results, we did intra-group and intergroup comparisons. And we saw improvement in verbal episodic memory measured by Ray Auditory Verbal Learning Test. As you can see, the blue line is the experimental group who took the pomegranate seed oil, and you see that they had improvement in their results. Also, we had improvements in multiple cognitive functions measured by Trail Making Test B, and specifically the processing speed and working memory. Here, the trail making test B has reverse scoring, so you see that the blue line that goes down means that the results are good for the people, for the experimental group. And in global cognition, measured by ADAS-COG, as you see, again, we have reverse scoring in this neuropsychological test. So the blue line that goes down means that there was improvement. Also, we had a reduction in blood biomarkers results. We had the reduction in the levels of p-tau 181 and increase of the amyloid 142 to 140. In the discussion, pomegranate seed oil, when it is used by people with mild cognitive impairment, improves the performance of short-term and long-term verbal episodic memory, measured by Ray Auditory, processing speed and working memory, and global cognition, but the limitation was that we didn't use a placebo. to compare the results. And the suggestion for further research is to conduct a multi-centered study with many people around the world. But the first results are very encouraging, showing that it could be a useful tool for holistic treatments for the prevention of Alzheimer's disease. So.
Thank you, Thanos. Perfect in time, 1 minute left. Then I would like to introduce our second presenter, Carlos Gómez Martínez from Spain. The floor is yours.
Hello, hello. Really glad to see so many people. I hope you enjoyed the day by now. Today I'm going to talk about quite a not traditional research method and how it's applied in Lithuania. So the Photovoice practice and care of people living with dementia, involvement for transformative change. In other words, is how people that have lived experience of caring of their loved ones can use photography to create a change in Lithuania. So first of all, about like the overall presentation is focused to introduce the research framework, but the research itself will happen in the beginning of next year. And just quickly about the Photovoice, 2 words, and all of us, I guess, heard somewhere people saying, don't talk, just show, and indeed it replaces, one image can replace a lot of textual information. And oftentimes it indeed provides that nuance that we cannot often grasp with words. And just to have this personal, myself as a keen photographer, I wanted to show this picture as just a way to explore a bit the method that the image is a way to create knowledge when it's intentional to take a picture, intentional to choose a picture from others, and when you belong to a certain community that has a shared experience. So I took this picture in the peak of pandemic when I lived in Ireland at the time, and I know we all share that experience, and if we would explore further, there would be a lot of knowledge because that's our shared space, I mean, of the experience that we encountered at the time. And as a methodology, creative practice, Photovoice as creative practice-informed approach in research. So in that case, people use photography to capture aspects of their life and share them with others. And this process combines photography with grassroots social action, and it's commonly used in the field of community development, public health, policy, and education, alongside more traditional research methods. So when I speak about what we capture, so the captured is like a lot of the nuances, the aspects of the context, the experiences, thoughts, feelings, emotions, things that can hardly fit in words. And very briefly about this practice as a process, and it enables people to record and reflect their community's strengths and concerns, and promotes critical dialogue and knowledge about important issues through group and small or bigger group discussions, and shares the knowledge collected with the wider public. And you can very kind of focus on what is your public. First of all, this is the community of people who share the experience, but then it goes beyond that. And just as a track of the whole process, how this happens. So there's the exploration of the methodology itself, the fieldwork, then reflection on the pictures that we took. We choose the pictures very intentionally, what we want to choose, what we want to show, what we want to explore together. We also add some textual, if we like, information to these images. Then we collect a set for images to spread a certain message. And I will talk briefly about that later. And then we can use that visual and textual information for different purposes. The least is to create awareness around, but also to refer to our policymakers. As a methodology, it's oftentimes like attached to these. Maybe you've came across this before. And in the framework of my research, so we use Photovoice to counteract the limited awareness of Alzheimer's and dementia in Lithuania, and that is done by strengthening the carers community, which is very spread and very, very weak links among people. Support their awareness of the care situation. You develop a critical understanding of your shoes, and then increased visibility through creative arts process, which is aligned with PPI. I mean, that's a very, very important part of it, that the whole process is very much empowering people to make these choices until the very end of the research. And the research team exactly includes people who have experience. So in the project, we will look into how the awareness of the care situation changed in different levels, and the photographies will be shared very widely. Thank you so much, and if anyone is interested in participatory action-based research, contact me.
Thank you for this really nice introduction to Photovoice. Then I would like to ask the next speaker to come up, Lorenzo.
You can see here that after the nutritional advice with 100% of satisfaction, the second most satisfied intervention arm with the most satisfaction was psychoeducational sessions with 89%. We also carried out, just when we finalized all of this study, we carried out a structured interview to gather feedback in each intervention branch. And we had 2 participants from each intervention group. So from all of the comments that we get from these, they highlighted the sense of group belonging. So they mean with these the groupal activities that they had with the same group from the beginning till the end, such as psychoeducational sessions and gym sessions. So with an overall satisfaction of 89%, we achieved an overall adherence of 80% to the study and very low attrition rate of 8%. In conclusion, we can say that it seems that psychoeducational sessions fostered a sense of community, which contributed to high adherence and unsatisfaction and attained a very low attrition rate. So the take-home message will be that lifestyle interventions for preventing cognitive decline should always consider psychoeducational sessions, promoting participant expertise, self-reliance, and sense of community, which ultimately impacts on retention and engagement. Thanks, first of all, to the study participants, and thank you.
Thank you, Thais, for a nice presentation, very informative. And I would like to introduce our next speaker, who is Aysan Mahmoudi, who will speak about social robots.
Good afternoon. My name is Aysan Mahmoudi, a researcher at Distinct Project, and today I'm presenting the results of a recent study on a social robot in people with dementia and mild cognitive impairments. So social robots for people with dementia are designed to provide aid with physical tasks and physical support, to provide companionship and enhance social interactions. The focus of this study was on a social robot called Mini, which is a small desktop size, a social robot capable of verbal and nonverbal interactions, meant to provide psychosocial stimulations and entertainment through apps and games. So ensuring the acceptability of such robots in this target population is crucial to make sure that the robot will be well adopted and effective. So we aim to explore the attitudes and acceptability of the robot and to see if there was any need for modifications on the platform. So we launched this study with 22 participants from memory clinics of Intrust Foundation in Castilla y León in Spain. And people had 2 to 3 weekly sessions for half an hour up to 1 month. And we completed pre- and post-test for questionnaire, acceptability questionnaire based on Almer model. And we also conducted interviews on the attitudes towards the robot at the end of the last session. And the data was analyzed by SPSS and NVivo software. So from the interviews, we extracted 3 themes. People per se expressed positive attitudes and appreciations towards the robot, but some considered it useful for people living alone. They perceived the robot as a relaxing and funny tool and a tool for learning new things and staying active. They had suggestions for modifications such as to consider new apps and graded games, to design more multimedia content, and the preferences on the physical appearance of the robot were quite mixed. From the Almer model questionnaires, all the constructs changed in post-test in favor of the robot's acceptance, except for the social presence and personality of the robot. The highest rated constructs were perceived enjoyment, sociability, trust, and attitudes. And the lowest rated construct was for personality of the robot and the social presence. The biggest mean value changes were for anxiety to decrease and also the personality of the robot to decrease over time. So we can argue that the longer exposure to the robot can decrease the anxiety and increase the perceived ease of use. Enjoyment increased at the end of last session, but the best intervention dose remains still a question, as it can result in exhaustion. The sociability of the robot could be linked to conversation features of the robot. However, small-sized social robot can reduce the social presence, perceived social presence, but they are better accepted rather than the bigger robots in human shapes, according to some existing studies on similar robots. So hesitation in adoption, in home adoption of the robot could be due to stigma, lack of need, fear of reduction in human contact, and disliking the robot that should be considered taken into account by stakeholders and researchers. And for the future versions of the robot, we can recommend that to developers to take into account a friendlier talking robot, less machine look and movements, graded games, and more multimedia contents. So this study affirms the acceptance and positive attitudes of the robot in people with dementia, addressing technical issues, enhancing the conversation features, and longer exposure to the robot can improve the acceptance of the robot. Thank you very much.
Thank you, Aysan, for sharing your insights on the mini robot. Now we go to our next presenter, Miren Altuna Azkargorta. Do I say that correct? From Spain. Floor is yours.
Hello, I'm a neurologist and I'm postdoc researcher. This is an honor to present for the first time my first project as independent PI. So this is the presentation of our clinical biological cohort. This is called Down Syndrome Basque Alzheimer Initiative. And as you may all know, Down syndrome is the most frequent cause of intellectual disability of genetic origin. We have to know that the life expectancy of people with Down syndrome has exponentially increased during the last decades, and now in the European Union is over 60 years. But obviously there are differences in medical comorbidities. in different ages as in general population. And we have to consider that late adulthood period in Down syndrome occurs like 20 years earlier compared to non-trisomic population. And Down syndrome is also known as trisomy 21. So we have to know that Down syndrome population at late adulthood that starts between 35 and 40 years old of age has higher risk of sensory deficiencies, but also of thyroid problems, also of adaptive disorders, but mainly of Alzheimer's disease, because Down syndrome is the most frequent cause of genetic etiology of Alzheimer's disease. All of the people with Down syndrome will develop Alzheimer's disease. This is due to the fact that in chromosome 21 there is a gene, APP, amyloid precursor protein, and we know that having a 3 copy of this gene is sufficient to originate Alzheimer's disease. For the age of 40, all of the people with Down syndrome will have Alzheimer's disease hallmarks in their brain. But fortunately, symptoms will start later. We can see here a figure, you can see there in green, people with Down syndrome that are asymptomatic for Alzheimer's disease, in blue, those with mild cognitive impairment, and finally, in red, those with dementia. We know that for the age of 60, 90% of people with Down syndrome will develop dementia stage Alzheimer's disease. We also know that Alzheimer's disease is the main cause of death in this population. So we started a new initiative. This is an adaptation of one started like 10 years ago in Barcelona. We are located in the Basque Country. Basque Country is a region that is located in the north of Spain, south of France, and we have 3 languages. We are offering our assistance in the 3 languages, Basque, Spanish, and French. So we are offering assistance for all people with Down syndrome, 18 years or older, with or without cognitive behavioral symptoms. We are offering the opportunity of neurological, neuropsychological assessment annually with all of the team, for those that are asymptomatic for Alzheimer's disease, for those that are symptomatic every 6 months. We are offering the opportunity both in diagnosis purposes or without diagnosis purposes and clinical research projects, the ability or capacity to perform lumbar puncture, magnetic resonance imaging, and also EEG and blood sample extraction. This is a population-based cohort, and we have been performing recruitment thanks to local association and foundation, collaboration with primary care physicians, neurologists, and psychiatricians. We also, with the collaborations with a lot of media, we have also in parallel started a comprehensive training adapted to Down syndrome population, their caregivers, professional and non-professional, and also for caregivers of professional setting, so in the first 8 months of the initiative, we have achieved more than 100 participants. This is more than 10% of the whole population that we pretend to target. I think that's quite huge. Most of our participants are mild and moderate intellectual disability, and more of a third part of our participants have Alzheimer's disease symptoms, and they were not previously diagnosed at the first visit time. In general, the interest in the research was very high. 100% of our participants accept follow-up and use of clinical research data for research purposes. And you can see that most of our participants agreed to blood sample on performing magnetic resonance imaging, and even almost half of them accepted to perform lumbar puncture. So take-home messages is that Alzheimer's disease is the main health challenge in this population, that early diagnosis is feasible, and we have to obviously perform research in this population. And thank you to all of you, and this is the team of CITA Alzheimer, and this is the founders. So that's all. Thank you.
Thank you, Miren, for highlighting this very important topic. And our next speaker is Rafaela Troulou from Greece, who will speak about music in nursing homes.
So, hello everyone. My name is Rafaela Troulou, And this presentation is part of an ongoing PhD study investigating the impact of community music making on the musical, emotional, and cognitive development of older people with and without dementia. So, what is community music? Community music making is active and participatory group music making. It is music making for all, and no prior musical knowledge or skills are required. As previously acknowledged, music can be used as an effective non-pharmacological strategy in dementia care. In particular, there is strong research evidence that active music making has the potential to improve the well-being of older people with and without dementia. So, as part of my doctoral studies, I conducted a community music program in 2 residential care facilities in Greece. The intervention took place from July 2022 until May 2023 and involved a total of 40 music sessions. 35 older people participated in the community music sessions, involving 12 with dementia of different types and stages, 14 with some type of cognitive impairment, and 9 with intact cognitive abilities. The music activities included singing, movement, and rhythmic playing on small percussion instruments to accompany songs. All the sessions followed a similar structure, and the collection of songs used in each session remained mainly stable and involved famous Greek and well-known to this age group songs. All sessions were videotaped with a 360-degree camera, and also semi-structured interviews were conducted before and after the intervention period with participants who were able to verbally express themselves, and 2 members of the care staff who were also present at each session. Preliminary qualitative research data suggest that the community music intervention contributed positively to the sense of well-being as well as the emotional and musical responses of people with dementia. In particular, first, the intervention served as a means of non-verbal interaction and socialization between participants of different cognitive stage and verbal abilities. As the music sessions went through, participants began to interact together more and more through music making, although their interaction and verbal socialization might be difficult due to their cognitive differences. This research finding is in line with previous research evidence which support the significant impact of group music making on the sense of belonging and overall social well-being of people with dementia. This finding also sets a significant base for considering planning more inclusive interventions for institutionalized older people with dementia. In this, those people are given the opportunity to interact not only with other residents with cognitive deficits, but with their fellow residents in general. Second, the use of a stable structure and repertoire seem to foster the emotional and musical responses of people with dementia, and especially those with limited language abilities or aphasia. The observational data from video recordings suggest that people with dementia, and even those in severe stages, were able to sing the lyrics of the songs or hum the melodies and imitate and recall rhythmic patterns and rhythms. There are also indications that the use of a stable structure and repertoire facilitated the gradual familiarity of all participants with the music process, while also serving as a means of accessible group singing for all. More research is needed in order to identify whether the use of a stable structure and repertoire could be key features when designing successful music interventions for people with dementia or other cognitive deficits. I would like to end my presentation with a very small video which gives a taste of the community music intervention conducted. No video. Could we have some voice, please, for the video? Thank you very much.
Thank you for showing us the power of music. Our next speaker will be Naia Ros, presenting to us on the CITA Go-On Study.
Well, good morning, everybody. My name is Naia Ros. I come from the University of the Basque Country, and today I'm going to explain briefly a part of my doctoral thesis. That's it, including the socio-emotional approach in a finger-like multi-domain intervention to prevent cognitive decline. And this is part of the CITA Go-On Study. Okay, as you know, depression and social adverse situations are some of the risk factors for developing dementia. In contrast, psychosocial stimulation appears as a protective factor against dementia. In fact, an adequate emotional education in the elderly seems to be beneficial in the face of psychological, cognitive, and medical problems. Based on the finger study, the Go-On pilot study, which is part of the worldwide finger too, proved the feasibility of carrying out a multi-domain lifestyle intervention in the Basque sociocultural context, including the socio-emotional approach or component as a fundamental part of the intervention. The objective of this work is to present the socio-emotional intervention protocol implemented in the CITA Go-On study, in the randomized control trial, and the adherence results obtained to date. To be included in the study, participants have to be between 60 and 80 years old and have a score of 6 or more in the CITA Dementia Risk Index, present an alteration in one of the brief cognitive tests applied, and refer cognitive complaints. And do not have dementia diagnosis. Before and after the 2 years that this intervention lasts, socio-emotional variables were assessed. And here in the first table, we present the main characteristics of the proposed socio-emotional intervention. This is a group-based model program with 15 participants per group, consisting of 16 on-site sessions of 90 minutes each. This proposed model is based on Salovey and Meyer's emotional intelligence model, together with the approach of the active aging paradigm as the frame of reference. The work content includes the psychoeducation, emotional awareness, emotional communication, emotional regulation, coping with loneliness, and promoting subjective well-being. To complement this group work, an individual homework assignment is sent that is consisting of listening to a podcast and one exercise related to the subject matter. In the second table, you can see an example of the session number 12 and the materials needed to carry it out. According to the results in this table, we present some descriptive results and the adherence results obtained to date. Participants were recruited in 2 different rounds, and participants from the first round have completed the first 11 sessions, and the participants from the second round have completed the first 4 sessions. If we take into account the total adherence to the first 4 sessions, we saw that it has ranged from 64 to 84%, depending on the season or the month that it took place, the session took place, and that the mean adherence is 70%. So to conclude, based on the existing background and looking forward to obtain confirmatory results, including the socio-emotional component in a multi-domain lifestyle intervention may be effective in the prevention of the cognitive decline. In fact, taking into account the exploratory analysis carried out so far, although there is a lot of data yet to be analyzed, it seems that the program could be beneficial in increasing satisfaction with life, mindfulness, emotional understanding, the capacity to relax, while also helping to decrease the anxiety. And finally, adherence results indicate that the intervention arouses participants' interest on improving their socio-emotional skills. So thank you, and that's it.
Thank you very much, Naia, for your presentation. And our next speaker is Electra Chatzidimitriou from Greece, who will be speaking about frontotemporal.
Ladies and gentlemen, esteemed colleagues and distinguished chairpersons, it is my great honor and privilege to participate in the 33rd Alzheimer Europe Conference and stand before you to share my PhD research work. Well, my name is Electra Chatzidimitriou. I'm a clinical neuropsychology and currently a third-year PhD student at the School of Psychology at the Aristotle University of Thessaloniki in Greece. I would like to start my presentation by providing an overview of the general scope of my PhD research. Well, during my doctoral studies, I collect and analyze longitudinal data of patients diagnosed with a behavioral variant of frontotemporal dementia in order to investigate the trajectories of functional status in behavioral variant FTD, as well as to examine and identify the predictive factors associated with functional decline in this clinical group. More specifically, we investigate the contribution and predictive role of various parameters such as cognitive deficits, behavioral disturbances, personality traits, as well as neuroimaging data from brain SPECT scans. But today I would like to share with you a part of my ongoing PhD research project that focuses specifically on the relationship between personality traits, both pre-morbid and current, and functional status in behavioral variant frontotemporal dementia. We know that this clinical syndrome is characterized by early and prominent personality changes that affect various aspects of everyday functioning. The goals of this specific research project are to illustrate the pattern of personality changes in behavioral variant FTD, as well as to investigate the relationship between personality traits and functional status in these individuals. In that framework, a total of 20 patients diagnosed with early-stage behavioral variant frontotemporal dementia were rated with informant-based measures with regards to their personality traits and everyday functioning. Pre-morbid and current personality traits were assessed with a Greek version of the Kohlberg's International Personality Item Pool Questionnaire based on the Big Five theory of personality, whereas performance on everyday activities was assessed with the Greek version of the Disability Assessment for Dementia and the Functional Activities Questionnaire. The results showed that, in comparison to their personality status a decade ago, before symptom onset, early-stage behavioral variant frontotemporal dementia patients demonstrated statistically significant decreases in the traits of conscientiousness, intellect, agreeableness, and extraversion, but not in the trait of emotional stability, which remained relatively stable over time. Interestingly, with regard to the relationship between personality traits and functional status and behavioral variant FTD, our preliminary results showed that, in comparison, higher levels of pre-morbid conscientiousness were associated with less pronounced functional impairment, suggesting that probably higher pre-morbid conscientiousness acts as a protective factor, predicting better functional outcomes in dementia. Similarly, we found that higher conscientiousness at present was related to better everyday functioning. On the contrary, we found that higher emotional stability at present was related to poorer functional outcomes, possibly due to the negative impact of emotional flatness on the initiation and effective performance of everyday activities. These findings have significant both theoretical and clinical implications, suggesting that probably by incorporating personality assessments into comprehensive neuropsychological evaluations in dementia, healthcare professionals and clinicians can gain valuable insights into their patients' pre-morbid and current personality traits, potentially aiding in improved prognostic estimates and treatment planning for these individuals. However, there is a need for further research in the field in order to confirm and expand upon these findings in larger samples and using maybe more objective measures. Thank you very much for your attention, and special thanks to the bursary sponsors for making my participation and presentation at the conference possible. Thank you all.
Thank you, Electra. Our final presenter would be Marina Macri. Is she here? Yeah. Okay. Thank you.
So, I'm a PhD student of Federal University of Thessaloniki of School of Medicine, and I'm working also in the Greek Association of Alzheimer's Disease and Related Disorder. And today I will present you a study which is part of a European project called Genetic Counseling in European universities, the case of neurodegenerative disorder. So we are a big team from all around Europe, and we have submitted this study in a journal, The Frontiers of Genetics, and this study focused on the attitudes of family members and non-family members of people with dementia toward pre-symptomatic screening. And also, we tried to explore possible differences in attitudes across 5 European countries. These 5 European countries are Belgium, Germany, Greece, Spain, and Turkey. And the final sample consists of 650 participants. We used the perception regarding pre-symptomatic Alzheimer's disease screening questionnaire, which have been created by our team, and a subscale acceptability of screening to explore willingness to undergo screening. And we also perform a group comparison to investigate differences regarding family history and country of origin. So the main results, overall, 56.9% of the total sample expressed a positive intention toward pre-symptomatic Alzheimer's disease screening, and we also found that personal experience with affected family members emerged as a significant factor motivating a more positive attitude. An international comparison revealed differences in acceptability of screening mean score across the countries. We also found that the Greek and Spanish subgroups, that means the Mediterranean countries, have higher acceptance of pre-symptomatic screening for Alzheimer's disease, which links with the family-oriented cultures, the strong tradition of family caregiving. They are more receptive to early diagnosis. They hope to have more time to prepare their family, and we found that they are more aware of the harms associated with care, including costs, family burden, and lack of well-structured plan for Alzheimer's disease patients. According to our results, Turkey's subgroup had the lowest interest in pre-symptomatic Alzheimer's disease screening. And as we know, this can be explained with a variety of religious, social, cultural, and healthcare-related factors. We also found that the samples from Central European countries like Belgium and Germany fall in the lower middle of cross-cultural comparison, and so no significant difference from each other, indicating similar cultural and healthcare-related emphasis. Because we know that these countries, when it comes to dementia, both have well-established healthcare systems and offer a substantial number of healthcare facilities, caregiving training, and also support groups. In order to conclude, we found that this questionnaire, the pre-ADS, and each subscale of acceptability of screening are reliable tools for assessing the pre-symptomatic Alzheimer's screening attitudes. Variations in screening and perception seem to be linked to family history and cultural differences. And finally, further research with larger samples is needed to explore underlying relationships. And this is the link of our project, the genetic counseling project. Thank you.
So thank you very much to the last speaker. We would like to thank very much to all our speakers, and just to say and appreciate that this session was possible, was organized by Alzheimer Europe Foundation and funded by Alzheimer Europe Foundation together with Roche. And I am very glad that also the chair of Alzheimer Europe Foundation is here with us, Heike von Litzau-Holbein, and representatives of Interdem Academy as well, Fania as a coordinator of different courses and so on. So I think that we all enjoy all these presentations, and it's a good step for the future in research and in the development of dementia research. The floor is yours, Fania, if you want to add some words.
No, I think this was really an interesting session. So congratulations all with getting this bursary and coming here to present your research to all of us. And thank you, and we wish everyone a very nice rest of the conference.